So, good evening, everyone. Thank you so much for taking the time out of your evening to join us today. My name is Jessica Giannino, and I'm the state representative for the 16th Suffolk District. And I'm here today with a wonderful team to share with you the importance of prostate cancer awareness in the era of COVID-19. So, you're going to get to hear from some speakers that are experts on the topic. I'm joined by my colleagues in the State House here with Representative Jeffrey Turco, who I share the great city of Revere with, as well as Senator Sal DiDomenico, who's one of our senators for the 16th Suffolk District. He is former rep from Revere. We miss when he was our senator as well, but so excited to work with Sal for the great city of Chelsea. So at this time, I'm going to hand it over to someone who's really been a leader for the community of Revere. She started this job not anticipating one of the most challenging health crises of her life would be beginning within her first several months within the city of Revere. Lauren Buck is the Director of Public Health for the city of Revere. She's done a phenomenal job leading us through the pandemic, and I'm so excited to have her here this evening. She's going to share some insight about the current status of COVID-19 in the city and how it's really affected us. So I'm going to turn it over to you, Lauren. Thank you.
Thank you so much. Like Representative Giannino said, my name is Lauren Buck. I'm the Director of Public Health here in Revere, and I'm going to give you a little bit of updates. I'll start with some good news about our vaccination status in the city and kind of where we're seeing our trends are going in terms of our cases and our positivity rate. So let's start off with the good news. So hot off the presses, as of today at 5 o'clock, in the city of Revere, our vaccination rate is at 62% fully vaccinated, and 70% of our residents here in Revere have gotten their first dose, which is great news. Our vaccination rates have slowly continued to increase from when we started our vaccination program now about 8 months ago. So we're continuing to increase our vaccination rates, which is great. Like the rest of the country and the rest of Massachusetts, our COVID cases are increasing as well. And I think we all know by now that can really be attributed to this really contagious Delta variant that we see going around. So just to give everyone kind of a picture of where we were back in late June and early July, our positivity rate, which means the number of samples, the number of people getting tested coming back positive, was about 0.2%. Right now, kind of in late July, early August, we're back up around 2.8%. And just to give everyone a little bit of perspective, when we were in our big surge kind of in the winter months of, November, December, January, February, our positivity rate here in Revere would range anywhere between 11%, 12%, 13%, 14%. So that's kind of where we were. And so we saw kind of a big upswing in the winter months and then a dip back down. And we were doing really well for, June and early July. And now we're seeing a bit of an uptick. And again, I think we can contribute a lot of that to the Delta variant. What's really good is in the state of Massachusetts and in Revere as well, we have not seen an uptick in cases that are resulting in hospitalization and death. So we've been able to break that link between number of cases and number of hospitalizations and deaths. The state of Massachusetts has recently released some data that shows when you look at people who are fully vaccinated, their kind of breakthrough case percent is very low here in Massachusetts, which is great. It's somewhere around 0.18%, so really low. And then it gets even lower when you think about the percentage of those cases that then kind of move towards hospitalization and then even to death. And so it becomes a really, really small percentage of something like 0.007% hospitalized in those who are fully vaccinated and 0.002%, something as low as that, people who end up passing away from COVID who've been fully vaccinated. And what that tells us is the vaccines are doing the right thing. They're doing the job that we wanted them to. They are preventing people who get COVID from becoming really sick or dying from COVID. And that's what we really wanted from the beginning. And I think here in Massachusetts, that expectation of what the vaccines could do is really holding steady, which is great, which is another reason why we want to continue to get our vaccination numbers even higher and higher. We want to get as many people vaccinated as we can. If anyone out there is still having hesitations about getting vaccinated, obviously one of the best resources that we advise people, trusted medical professionals, to get a second opinion, to get questions answered. That's your primary care physician, nurses, doctors that you respect and have a good relationship with are really great resources to go if you have questions. And, at those regular visits that you can go to if you have questions, it's another great place to kind of get a checkup on all your preventative screenings that a lot of us have probably missed over these last couple of months because of fear of going to the hospital, because of fear of going to the doctor's office. And I think right now, we've shown that our hospitals, our doctor's offices are really good at preventing infections, are preventing spread of disease within those, within their buildings. And so they are safe places to go to answer some questions and get caught up on all those preventative screenings, our cancer screenings that we need to make sure we're doing on a regular basis. So it's kind of like a 2-for-1, kill two birds with one stone. Get those questions answered about any hesitations you might have about getting the vaccine. We know they're very safe. We know they're effective in what they're supposed to do. But if you continue to have questions, it's a great place to go. And also, get caught up on all your preventative screenings. Thanks so much, Jess.
Lauren, thank you so much for your time and for that information and for being here today with us. That was super informative. And for anyone that does have any follow-up questions or vaccine questions, feel free to reach out to me in my office. I can get you in touch with Lauren. She's phenomenal. If you know someone that needs a vaccine, if you're looking for one, reach out and we can get you connected. So thank you. The next person that I'm going to introduce this evening is one of the first advocates I had the pleasure of meeting after being sworn into the State House. When I first met Dr. Stern, she was glowing on Zoom and was so excited to share this information with me. And ever since, I've been so lucky to be in communication with her and to learn more about what's happening with this foundation and relative to prostate cancer. So for those of you that may not know, this is a personal issue for me and my family. My grandfather, Christy, who many of you know and love, passed away 10 years ago from prostate cancer. So it definitely is important to us. And, I know what he went through for 10 years battling this disease. I know how difficult it was for my family. So preventative care is so important when you're fighting cancer. So definitely happy to be here today to share this with you. So on that note, I'm going to introduce Dr. Stern, who's the president and CEO of the AdMeTech Foundation.
Thank you so much, Representative Janina. I would like to thank you and Sal Di Domenico, who have been supporting our prostate cancer program for longer than I can remember. I also would like to acknowledge presence of Representative Terko, who is a new addition to the State House. Welcome to this event, and we are very grateful for your support of our program. We actually prepared a brief video.
We have some wonderful elected officials and representatives from the city of Revere and the city of Chelsea on this call. Rep. Turco, would you like to say anything in the moment to fill this little technical void?
I just want to thank you and Senator Di Domenico and the whole team here, the public health in Revere and the doctor and her team for highlighting this issue. It's so critical. These are issues that obviously people don't like to talk about, men like to talk about, particularly as they're getting older and need to get these exams. And so I think this is a great opportunity to remind people that a little bit of prevention can go a long way in saving your life and saving your family the misery of something bad happening. So thanks for your leadership on this. I appreciate it.
Thank you, Rep. Turco. Senator Di Domenico, did you have any comments you'd like? And then I'm going to kick it over to Allie to start the video.
Sure, I'll be very brief because that's more important than listening to me. But I want to thank you and my friend Representative Turco as well, and everyone on the line today. And I also want to just give a special thanks to Lauren. I know all of our public health officials in our local communities have been in the trenches fighting this war on COVID. And I want to thank you, Lauren, and everyone else who's doing so much. And my phone's ringing, of course, I'm during my Zoom. but just all the work that you have done and all the pain that you have lessened for all of us in our communities because of what you're doing. So my public service announcement is to get vaccinated, everyone who's listening to this. Please get vaccinated, for not just for yourself, but your family and your community. And the prostate cancer piece, I also just want to mention what Representative Turco said in terms of the prevention. Getting screened is so important. A lot of these issues that we have in medical issues that have been put off. And as Lauren said, people have been afraid to go to the hospital or to the doctor's office for fear of catching COVID or leaving their home. It is critical that we have all these screenings done in a timely fashion, because it will save you pain and suffering down the road. And again, not just for you, but your families as well. As Gino mentioned, seeing her grandfather going through this, it had an effect on the entire family, not just the person. So I implore everyone to get vaccinated and get screened and keep us all healthy together. Thank you very much.
Thank you, Senator. I also want to acknowledge School Committeeman D'Ambrosio, who's joined us today. And I'm going to kick it over to Allie to start the video.
I would like to start by expressing my gratitude to Representative Giannino for organizing and hosting this event. Our event today is made possible by the ongoing program in prostate cancer awareness and education, with primary focus on high-risk men, including African American and Hispanic individuals. This program was initiated in 2009 and strongly supported by Representative Giannino. Both COVID-19 and prostate cancer have emerged as leading health disparities. In April last year, early in the pandemic, we have recognized that the areas of prostate health disparities directly overlap with the pandemic hotspots. Since May 2020, we have expanded our program to include education about prevention, diagnosis, and treatment of both prostate cancer and COVID-19, as reflected in this event. Prevention and early detection are critical for saving lives and eliminating disparities in both prostate cancer and COVID. The future of this pandemic depends on us. What can we do to end this pandemic and protect our families and our communities? We can drive down infections drastically by wearing masks, particularly indoors, in combination with reducing social contacts. If we develop flu-like symptoms, we can ensure early testing and self-isolation, as well as help public health experts to trace our contacts. We can end this pandemic by complying with vaccinations. The best data we currently have for Massachusetts indicate that increased vaccinations resulted in several months of the pandemic decline. However, in the face of lifted restrictions on masks and social distancing, the new Delta variant caused a steep increase in daily infections here and nationwide. You can also see that with increase in use of masks alone, the pandemic can be flattened in our state. And yet, the current low compliance with masks is expected to result in a steady increase in daily cases that may reach or exceed the level of daily infection, which was very high and seen last winter. If we look at today, August 5, we can see that with universal masks, about 1,000 new cases are expected each day. With low mask compliance, on the other hand, we may have over 2,000 cases each day. By September 27, we're expected to have only about 246 new cases each day with universal masks, while we may see over 8,000 cases each day with the current low mask compliance. COVID vaccines have been proven safe and effective in millions of people. Vaccines prevent severe disease, hospitalization, and death in countless people. Many experts pointed out that vaccines could have prevented almost every death we are seeing today. Complications are extremely rare. We are much more likely to get into a car accident and related serious injury than develop any major complications from COVID vaccines. Vaccines are the best way to protect not only ourselves, but also our families and our communities. By accepting vaccinations, every individual helps us get one step closer to ending this pandemic and being able to see our families, friends, and co-workers safely. On July 27 this year, U.S. Surgeon General Dr. Vivek Murthy shared publicly that he lost 10 relatives to COVID-19. He pointed out the mask help us reduce spread of infection, while vaccinations remain the bedrock of ending this pandemic. In prostate cancer, screening with blood tests called PSA is the best tool we have for prevention and early detection, critical for saving lives. Screening and early detection are particularly important for Black, including Hispanic men, who are about 2.5 times more likely to die of prostate cancer compared to white men. With early detection, every man is alive in 5 years. With late diagnosis, when distant cancer spread is present, only a fraction of men, about 28%, are alive during the same period of time. It means that we may lose 72% of men with distant prostate cancer spread. Since 2009, AdMeTech Foundation established a prostate cancer equity program, including statewide public awareness and education campaign. More recently, we started building infrastructure for improving access of African American and Hispanic men to high quality care. To achieve that, we have been working with the Mass General Brigham Health System and other states' leading experts and leverage extensive partnerships AdMeTech has built with community organizations, including but not limited to Latino Health Insurance Program and regional NAACP. Dr. Adam Feldman, participating in this event, is one of the key leaders in our joint efforts. In summary, prevention and early detection and related public awareness and education save lives and reduce health disparities in both COVID-19 and prostate cancer. Large-scale masks and vaccinations resulted in a significant decline of the pandemic. However, with lifted social and masks restrictions, we are currently facing a rapid spread of infections and death, disproportionately in the unvaccinated individuals. We are again in the race between virus variants and vaccines. Dr. Adam Feldman will address the latest advances in prostate cancer care and the importance of screening, early detection, and treatment. Thank you for your attention.
Thank you, Dr. Stern. Did you have anything to say at the end of the video before we introduce our next speaker?
I will be happy to address any questions anyone will have at the end of after Dr. Feldman will complete his presentation.
Great. Thank you so much, Doctor. So I'm honored to introduce our next guest speaker this evening on this call. That is Dr. Adam Feldman. He is a urologist at MGH, an assistant professor of surgery at Harvard Medical School, and director of combined Harvard Urologic and Oncology Fellowship. So, Doctor, thank you for taking the time to talk about this important issue with the 16th Suffolk this evening.
Great. Thank you so much, Representative Giannino. It's such a pleasure to be here. And it's an honor to be amongst all of you and, to be amongst all of the leaders of the government who really help to keep our communities healthy and safe and everything running so smoothly. So really appreciate that. And thank you, Faye, for welcoming me here. It is always a pleasure and an honor to work with you. I'll echo what was already said in an enormous amount of hard work that you do on behalf of men with prostate cancer. It's really amazing, all of the work that you do and that AdMeTech does. You have an amazing way of always getting things done, and our patients very much appreciate it. So I am going to, hopefully, if I can, share my screen. Looks like I can, and hopefully everybody can see this. I just have some slides that I think are helpful to illustrate what I'm talking about. So again, thank you, everybody. So prostate cancer is the most common cancer in men. In 2020, there were over 190,000 new cases in the United States. And in the United States, it's the second most common cause of cancer death in men, with over 33,000 deaths in 2020. And about 1 in 9 men will develop prostate cancer. Interestingly, and I'll show a slide of why we used to say 1 in 7 men, and it's really the difference in detection, in the decline in detection in prostate cancer, and that's where these discussions are so important, and I'll get to that. So Faye had mentioned PSA, or what's called prostate-specific antigen. It's the blood test that we use to help screen for prostate cancer. It's a protein in the blood. It actually has a role. It was first identified in 1971, and then through the 80s was investigated and evaluated for screening for prostate cancer, and then was approved in 1994 for screening and the early detection of prostate cancer. So this is an interesting slide that looks at there's publications and papers that talk about the incidence of cancers in the United States. And the brown line, if you can see my arrow, and this is over time. This is the incidence of cancers, or sort of the rate of cancers, basically over in the United States over time from 1975 to 2015. And here you can see that prostate cancer, the rate of diagnosing prostate cancer in the United States shot up around the time that we started using PSA. And that's not because there were more people necessarily getting prostate cancer. It's because we were finding them, and we were finding them earlier. And then that peak sort of leveled off as we found those men in the population that had prostate cancer. And then here you can see, I'll go away from this circle here and get to this one. This is mortality or death from different cancers. Again, the brown line is prostate cancer. And you can see that since PSA testing had started, mortality from prostate cancer declined over the nearly 30 years that it had been being used. And this is then a very interesting circle here. There's a drop in the incidence of prostate cancer. And really that can be explained by some controversy about PSA and about detecting or screening men for prostate cancer using PSA. And that controversy has been really since the start. But what's called the U.S. Preventive Services Task Force, this is an agency that makes decisions about screening tests for all types of, like, mammograms and PSA and all types of different screening tests. And they actually changed their recommendation in 2010 to say not to use PSA. Many of us disagreed with that. And then what we saw actually was that there were fewer cases being found after that decision. There were fewer cases of localized prostate cancer, or prostate cancer that's confined to the prostate, and more cases of prostate cancer that had spread. So what we had identified was that PSA testing really is beneficial. And actually in 2018, then the U.S. Preventive serves as task force, they actually reversed their decision and said, well, we should be using PSA. We should have the discussion of using PSA. And many of you may be on the call and may say, my doctor, several years ago told me that we don't use PSA anymore. We shouldn't be using PSA. Why is that? And that explains the reason. Okay. And it's not because of any negative things. It was just an interpretation of some studies that had been done. We know PSA is not perfect. There are other reasons to have an elevated PSA. Many men just have an enlarged prostate. Infection, what's called prostatitis can be a cause of elevated PSA, and some other reasons. So it's not always just because of cancer, and that's part of the difficulty in using it. So these are guidelines from what's called the National Comprehensive Cancer Network. And just to say that when we think about a patient and evaluate a patient for prostate cancer, we're taking into account a lot of things. Their who they are, what's their family history. Dr. Stern indicated race, and also family history is not just of prostate cancer, but there are some other important types of cancer that are important that we ask about. Family history of early breast cancer, ovarian cancer, colon cancer, pancreatic cancer. There are some links to prostate cancer, and these just are some of the genes that are involved. So they're not going to go through this in detail, but there are a lot of other blood tests that we sometimes that are available. Sometimes we use them to help us determine who with an elevated PSA should either get imaging or biopsy. So there are a lot of options. None are perfect. The other thing that we use a lot that people may have had or may get recommended to have if they see, a doctor about their PSA test is an MRI. And that's become very commonly used now to evaluate men with prostate cancer. And for one reason is this is just some data to suggest that MRI is actually often better at identifying men, or evaluating prostate cancer than some of these other sort of urine-based or blood-based biomarkers. So we use all of these data in conjunction, but MRI is really very, very helpful. And then what we can do is we can take the information from an MRI. MRI is an image of the prostate. And the way we do a biopsy of the prostate is by using ultrasound at the time of the biopsy, and that's how we diagnose prostate cancer. And we can actually superimpose the images from the MRI and the ultrasound, and help us more accurately identify areas of prostate cancer within the prostate. So the reason we use MRI is we know that MRI of the prostate actually can be very helpful, and sometimes even of helping us to avoid biopsy for men who may not need it. It can also make our biopsy more accurate in identifying what we call significant prostate cancer. And so I say that because there are some types of prostate cancer that may not need to be treated, and this is some of the times the challenge is identifying those cases of prostate cancer, or those men with prostate cancer who really do need treatment and really would benefit from treatment, versus those that we can maybe safely watch. Another thing you may hear about if you see a doctor or a urologist is sometimes we're doing a new way of doing biopsies where it's actually the needle when we do the biopsy is going, rather than used to always go through this is an image that shows the bladder, just to show what is the prostate. This is the bladder. This is the prostate. And the prostate is part of the male reproductive system, sits right underneath the bladder. And then when you have a prostate exam, it's a rectal exam actually, and then it's in order to feel the prostate, okay, and assess for anything that feels abnormal. And that's actually how the biopsy is done. There's an ultrasound that goes into the rectum to show us the prostate, and then we sample the prostate with a needle that either goes through the wall of the rectum or in through the skin here, just underneath the scrotum. And that is a very safe way of doing a biopsy, actually, with a lower infection rate. So that's what, that's one of the sort of newer developments really in the past couple of years in order to more safely do prostate biopsies for men. So what are, this is prostate cancer care in 10 minutes, so I know I'm going very fast, but what are some of the, when we find prostate cancer, I'd mentioned one, active surveillance. So some cases of prostate cancer may not need to be treated, but some do require treatment. And so options for prostate cancer treatment include either surgery or radiation. And then there's an emerging area called focal therapy, which is really investigational but emerging. And surgery is removal of the entire prostate. Historically, that's been done with an incision or with what's called open surgery. Now, more commonly, we're doing it minimally invasive, and this is what's called the Da Vinci surgical system. It's a robotic surgical system that we can do it in a minimally invasive fashion. And there are various forms of radiation. The most important takeaway message here is that men who have been found to have prostate cancer have options. And that's because surgery and radiation, they're equivalent treatments for prostate cancer, okay? Focal therapy is emerging. People may have heard of what's called high-intensity focused ultrasound or other types of focal therapy, and that's emerging and really more investigational. So this is just to show some of our work and to show that men who have prostate cancer, which may not need to be treated, and we often do what's called active surveillance. And at about 10 years, about 50 to 60% of men end up being able to avoid treatment for prostate cancer. So that's really good progress in the past 15 years in order to try to reduce some of the side effects from treatment. So in conclusion, we know that PSA-based screening and detection really remains the standard for evaluating men for prostate cancer. And just as everyone has said on the call, we really encourage people to get screened, and early detection really is the key to helping to avoid some of the difficulties with prostate cancer that has spread. We use many different ways to detect it, including PSA again, but also some other markers, blood tests and urine tests, and then also MRI. And then there are many options for helping to treat men with prostate cancer. So that is, and that's an actively growing area. So I know I'm a little over time, which is why I'm skirting some of the other conclusions. But again, thank you everybody for the opportunity to chat, and happy to take questions later on.
Dr. Feldman, thank you so much for that. That was super informative. And I'll tell you, as someone that lived with someone going through this cancer and these treatments, I learned a lot today myself. And a lot of those terms were said about my house, like PSA and appointments for PSA screening, where are the levels at? So what's the next step? So that was very, very informative. And I definitely have some questions for the end.
Sure.
But at this time, I believe you are the last guest speaker for the evening. So I'll hand it back over to Dr. Stern, and then we'll go over to some questions and answers.
Okay, so we are ready for any questions from anyone participating on this panel and from people who watch this event from Facebook.
In the meantime, I see School Committeeman Anthony D'Ambrosio here from the City of Revere has a question. So Anthony, I'll hand it over to you.
Thank you, Representative, and thank you all for doing this tonight. It's much appreciated. I apologize if this was sort of gone over a bit ago. I joined a bit late, but what are some very, effective and simple steps that we might take as local officials to kind of publicize this information that have worked in your experience?
Adam, do you want to address this question?
Well, yeah, I mean, I think that I think Representative Turco mentioned that men sometimes have a difficult time talking about these things. And it's true. I mean, I take care of a lot of men who it's not easy for men to talk about their sort of personal health issues sometimes. And I guess what I would say from a community standpoint is to open the discussions in, whether it's town hall meetings or just with your community gatherings. I'm sure there are many community gatherings that you go to as representatives. I think just opening the discussion, about, talking to your primary care physician and getting information. There's a lot of good information online about prostate cancer. And, certainly through AdMeTech, another wonderful organization is the Prostate Cancer Foundation. There are a number of good organizations that have good information online. And I think just starting the open dialogue, I think, is probably the most important thing. And I think encouraging men to ask their primary care physicians about testing for the very reason that I talked about, that, during that time period when the U.S. Preventive Services Task Force said, no, don't use PSA testing, there was really a generation of primary care physicians that were trained not to use it. And, what we want to try to do is to flip that back and to reverse that and to encourage screening for prostate cancer. And so I think it's important to have those discussions, for men to have those discussions with their primary care physicians.
If I were to summarize what Adam said and turn it into a headline, I would say that for representatives, for senators, for political figures, what is important to talk about when it is appropriate is if man reaches age 45, men with average risk, they need to start conversation with their doctor about possibility of screening at the latest at the age of 45, based on the best science we have today. If men have Black heritage, African heritage, and they have family history of prostate cancer, particularly father or brother, they must start these discussions at the age of 40. So the bottom line, I would say that for Black men, they need to start this conversation at the age of 40, possibility of screening for prostate cancer. Average risk men at the age of 45. If there is anything that comes up appropriate during town halls, how old are you? It's about time for you to talk to your doctor about prostate cancer screening.
Thank you, doctor. It looks like Rep. Turco had a question.
Yes, thank you. I think the doctor just answered it. It was really, colonoscopies for colon cancer. They was 50 was the recommended age for the test. I understand they have lowered it to 45. I just wanted to confirm on prostate cancer, what's the age where a man should be saying to their doctor, hey, I'd like to be screened? And I think the doctor stands at 45 is also the age. So, you're getting one, you should get both, just to be on the safe side. Is that a fair assessment?
Yeah, and I would argue if you have a family history of early prostate cancer or aggressive prostate cancer, that I would even argue at starting at age 40. And it's not, and I'd mention this, it's not just a family history of prostate cancer. So if you have a family history, and it's a first degree relative, so a sibling or a parent, but someone who's had early breast cancer or early ovarian cancer or even early colon or pancreatic cancer, we've broadened the family history discussion. We've broadened the discussion of what other types of cancers people have, because we know some of the genes that are involved now.
And this is very important discussion about the risk factors. This kind of cancers that Adam just mentioned represent high risk factors potentially in future generations, in younger generations. And another major factor is African heritage, Black men, in addition to family history of cancers, Adam mentioned. So these men need to start their discussion about prostate cancer closer to the age of 40. But any man should have discussion with their physician about prostate cancer screening by the age of 45, because PSA testing, as recent data indicate, PSA testing, what we call baseline testing, then at the age of 45 is important not only for early detection of prostate cancer, by determining how frequently future testing will need to be done.
Thank you, Doctor. And Doctor, I don't see any other electeds that have questions on the call, but I have a question after seeing your presentation. Something that really alarmed me is I had never realized that there was a connection between breast cancer and prostate cancer. And I saw the BRCA gene listed on your chart. And as someone who has many cases of breast cancer in my family, as well as prostate cancer, that was alarming to me. But I guess my question, because I know I'm not the only one that's in that position, for say a young man, maybe in his 20s, that has a parent or grandparent that had both on either side. What do you recommend in terms of prevention and being aware and anything like that? Because I did not realize that there was a connection there, so I found that quite alarming.
Yeah, that's a great question, and that's actually, I was going to say that's a question I get asked a lot when I have men who have prostate cancer, and we're treating them, and they say, "Well, when should my son start getting screened?" And the age is 40 to start getting screened. But there also raises the question about getting tested for these genes, what's called germline testing. I think if you have a sibling who had breast cancer at an early age, or one of these other cancers at an early age, I think, first of all, or if you know a family member that has the BRCA genes, either one or two, then you should consider getting, genetic testing. So, and there are, and when you go in to get, by the way, it's important to know when you go in to, you start with genetic counseling. You don't just go in and get the test. It's a discussion and a conversation, because, everybody has questions. Well, if I get the test, what does that mean? And if I'm positive, what does that mean? And you're not just getting the test and getting the results in a vacuum. It's a real discussion with genetic counselors and everyone. So, those are important conversations to have for sure. And getting tested is an easy blood test, and it can have important information.
I think it is important to point out, in addition to what Adam said, we are very much, AdMeTech Foundation is very much aligned and supports guidelines developed by National Comprehensive Cancer Network, mentioned by Adam. This network consists of leading experts in clinical care and research from over 28 leading cancer hospitals in this country. This is a standard setter, not only for this country, but also internationally. And what they recommend is if PSA is 3 or above for men between the ages 40 and 75. It is really important to ask for consultation by urologist. Please, it's important to remember, when PSA is 3 and above, please ask your general practitioner to refer you for urologist for further evaluation. If you're between ages 40 and 75. When you're reaching 75 and your PSA reaches 4, please ask to be referred to urologist, specialist in prostate cancer like Dr. Feldman, so that you can sort out with a specialist like that whether or not you need, what kind of further evaluation you need, and whether or not you need genetic testing.
Thank you, Doctor.
Yes.
Senator DiDomenico.
Yes, so this could be a crazy question, but I just want, as we're talking, I just thought of this. So when people go in for their annual checkup and they get blood work done by their primary care, is PSA part of that package of results, of the tests that they get tested for at a certain age? or is something that people have to ask for in addition to what they're getting tested when they get blood drawn?
That's a great question. Yeah, that's a great question. And I would say it's not automatic. And the reason it's not automatic is because of the controversy around PSA that I talked about, the PSA testing. So, and that's why all of these conversations are so important, because sometimes people may need to ask for it. So, the current recommendations from the U.S. Preventive Services Task Force is not to use it. It's the current recommendation is to have the conversation about possibly using it. So that's really important to know. And so, yes, I mean, there are some physicians who might just, get it automatically, but usually there's a conversation that's had and they should talk to you about it. And if they don't talk to you about it, yeah, you should ask.
I would like to point out that we prepared a one-page summary of information that can prepare in turn patients to talk to their doctors. We'll be happy to share this information with Representative Giannino and Representative Terco and Senator DiDomenico, so that they can share it with their constituents in case concerns or questions come up.
And I also want to point out that it's really important to point out that, if it hasn't been discussed with you, and if you haven't ever had it before, it's not because of anything that's been, done wrong. It's because there has been controversy about it, and people, the community, we as a community as a whole, we really have been trying to, over the past, 30 years, understand if it really does help men, and if it really is helpful and beneficial. And, what we've seen over the past several years now and really now understand is that it does help. And so we know that now. But that's really been the reason that it hasn't become just a hands down recommendation.
Thank you, Doctor.
Or it hadn't previously become a hands down recommendation, I should say.
Well, I want to start by thanking everyone that took the time to be a part of this call. Lauren Buck from the City of Revere, thank you for being here. Dr. Stern, thank you for putting this together. Thank you to your team that's on this call today. And thank you for bringing Dr. Feldman here and for taking time out of your busy schedule, Doctor, to be with us. To my colleagues in government that are here today, Senator DiDomenico, Representative Turco, and School Committeeman D'Ambrosio, thank you. For everyone that took the time to watch on Facebook, thank you so much. And if you have any follow-up questions, please reach out to me so I can share any information with you. If you haven't already, follow the AdMeTech Foundation on Facebook. They post their events, they post what's happening. And I've also shared this live to my page so you have their contact. I hope that everyone learned something today. I think there were a couple of takeaways. If I can summarize, if you're over 45, get screened. It's important. If you're high risk and over 40, get screened. It's important. And the biggest takeaway that I can push that we've been talking about for a year is get vaccinated. If you haven't got your vaccine yet, please, please, please get your COVID vaccine. If you have questions, you have a team of people here, many on this call that are here to support you. And please use us as resources because we're here to help and to spread awareness and to stop this virus. And this was so informative. So I want to thank again everyone on this call for taking the time to talk about prostate cancer awareness in the era of COVID-19. I think this was super informative for our residents of the 16th Suffolk District and beyond.
Thank you very much.
Thank you for having me.